And we are back. Every year, approximately 1 in 5 New Yorkers experiences mental illness. It highlights the significance and I should say the significant impact on individuals within the community. But fortunately, there are therapy available, and that offers a valuable opportunity for individuals to effectively manage life's diverse challenges and then lead more fulfilling lives. And by engaging in therapy, a person can gain a deeper understanding of their emotions, their origins, and also learn effective coping strategies. We're pleased now to have sharing with us more clinical social worker Alexandra Perez, and thank you for being with us.
Thank you so much for having me. Thank you for allowing me the opportunity to share my knowledge with everyone.
Yeah, well, first of all, thank you for the work that you do.
Thank you.
And I got to ask the question when we talk about mental illness, how prevalent are we seeing it in our community?
It's really, really high. We're seeing that mostly children are experiencing a lot of mental health disorders such as anxiety, depression. We're seeing how this is impacting them in their school performances. So we're definitely seeing a rise within mental health illnesses across New York City.
Yeah. And so when we talk about our children and we talk about the numbers continue to rise, are there particular communities within our area that we're seeing rises?
Definitely, we're seeing, I can speak to you in terms of the Bronx itself. Definitely in the South Bronx, we're seeing a rise in mental health illnesses and communities where there's definitely a lot of poverty. That's rising a lot in terms of people being able to, having difficulties coping with like just life stressors.
Right. So for your job is really to help somebody through it, right? You're a clinical social worker. You talk to families, you talk to young people as well. Walk us through a little bit about what you do.
Sure. So if someone comes to me for help, we really want to be able to get a clear sense of like their history, their presenting problem. We want to get a large scope of what makes this individual, right? Like what are some of the things that this individual has struggled with in the past? What are some of the goals that they want to work on? And so in conversation, we develop a therapeutic relationship, and we're able to pinpoint what are the things that this individual is going to work on and grow, and we'll design a treatment modality that is going to help this person be successful in whatever goals they're developing with me in session.
You talk about therapeutic relationship, right? So a relationship takes time. You have to develop that relationship. We know that particularly in communities of color, that relationship becomes like, strained, because there's this huge stereotype barrier. People don't necessarily like to come to counselors, right? Like to seek therapy. Are we seeing more and more people become comfortable with the fact that I can come through the door, I can come see Alexandra?
It's still a challenge, because there is the stigma that, when you go to therapy, it means you're broken or there's something wrong with you, right? And so we're still working towards trying to break that stigma so that people can feel more comfortable going to therapy and being able to get the help that they need in order to solve some of their issues, presenting problems. So I have seen more and more people that are willing to come and speak, but there's still more work left to do in that area, for sure.
We think a lot about children. We think about young adults. We think about youth, right, when it comes to that. But when we see children, talk to me about children, the ability for them to be able to get help. Because there's so many children right now who are being affected by so many things that are going on in life and traumatic things. We think about school shootings. We think about all that's the macro level. But reality is that on a day-to-day life, what goes on with mom and dad, or no dad, no mom, that becomes something too. What's available for children at this stage?
So for children, they're more the most vulnerable population because in order for them to receive therapy, especially outside of their home and outside of their school, their parent has to be extremely involved in that process, right? So it's really urging parents to be able to provide that support to our kids in order for them to receive those services outside of their home. But, I think that in schools, there are programs that are in some schools in order for students to be able to get that support. Many schools have social workers, many schools have counselors that can provide some of that support. And so when possible, students will be able to get that within their school settings. But outside of school, it's really the parent who has to be that frontline person that helps them consistently obtain that help outside of their home.
To get help and to really be able to come through those doors is a huge step. What advice do you give to people who really know that they need to take that step, but whether they're afraid or maybe these misconceptions that are out there, they don't come through the door? What advice do you have?
I would say that it's important. It's important for people to overcome those stigmas that mental health carries. It's important for people to take that first step and reach for help and be able to obtain the knowledge and the skills that are going to help them deal with whatever stressors they're dealing with at home or in their community, right? So I do urge people to reach out to. There's definitely a lot of websites. BetterHelp is one of them. Psychology Today. I usually refer a lot of people to New York Psychotherapy. They're located in the Bronx, and they accept referrals. And so they work with families and individuals. I myself see individuals and children and families. So there's the help is out there. It's just a matter of going out there and looking for it and being open to change.
Alexandra, in your work, talk to me about COVID, post-COVID. We consider this post-COVID. But now that we're coming out on the other side of it, what are you seeing coming through your doors by way of people and the need for services?
There's been such a huge impact. COVID has had such a huge impact on people's mental health, children's mental health. I've seen a lot of children suffering from anxiety, children who don't want to go to school anymore because they're just afraid to be amongst a lot of people. I've seen children who are very depressed, individuals who are very depressed since COVID because they still haven't mourned the loss of their loved ones. They still haven't been able to mourn the loss of just their regular day-to-day life. Like COVID was such a fast-paced change for everybody, right? And so people have developed traumatic experiences from that. And we see a lot of people that are struggling with being able to deal with day-to-day life stressors that maybe prior to COVID wasn't a big deal, but since COVID, it's been harder for people to deal with, right? People have stressors like they can't find jobs, or they've lost their home since COVID. They've lost loved ones. So a lot of loss that people have had to deal with in a short amount of time. And so I'm seeing all of that in my practice.
Yeah. A lot of people sometimes won't come through the doors because of cost. There's a fear factor of, this is going to cost me a lot. This is highly expensive. But tell me about the cost and what's the cost associated with, really having therapy and counseling sessions.
Well, a lot of therapists like myself accept insurances, but if you don't have insurances, there's a sliding scale, and so it really depends on your income. And a lot of therapists like myself would be able to evaluate what would be a lower amount that you can pay, right? So if a session would be $65 per hour based on your income, it can be lower than that. So people can have ways of being able to pay for services. It's just a matter of starting the process and taking that first step.
And what if I'm that person that I'm really financially challenged and I can't afford therapy? What are the options that are available for me?
Well, there's definitely resources that can assist people in obtaining Medicaid, for example, and Medicaid insurance, and being able to afford therapy through that type of insurance. So it's just a matter of being able to connect with your local agency and having that assistance.
Yeah. You spent the majority of your time of life right here in the Bronx, doing work in the Bronx and serving the Bronx. What do you say about the Bronx from your angle, and what can you give us an assessment as to what you're seeing through the lens of people?
I think I take a lot of pride in being able to give back to my community in this way. Like you said, I'm born and raised in the Bronx, and so being able to deliver some of my expertise to people and help people and families do better, it just gives me a lot of joy and satisfaction. I think that people in general are going to need to break through those stigmas and really try to gain access to mental health. And I think that our community leaders have to do even better job in expanding some of the resources that are out there for people to obtain mental health services. And I foresee that if all these things can take place, like we as a community can do better.
Right. What have you seen has been the greatest improvement in the work that you've been able to do lately?
I've seen my clients go from not knowing what they want to do in life to being able to start back in college and getting master's degrees and being able to like really change their circumstances. I've seen families that are at a point of just everyone separating and divorce taking place to really coming together as a unit and striving. I've seen children who have not had any intentions of going to school, start going to school and being able to do well academically. So there's a wide variety of progress that I've been able to see with individuals, with families, through my work with them.
Yeah, well, Alexandra, I want to thank you for coming to share with us. And
You're
thank
very
you for the work
welcome.
that you do, as we say, highly impactful in the lives of people, and keep doing what you do. Sometimes you don't get the credit that you always deserve, but we'll give it to you here right now. Thank you.
Thank you. Thank you for having me.
All righty. Well, now listen, if you want more information, you can schedule an appointment through her email at alexandraperez335@gmail.com. We encourage you to don't go anywhere. We'll be back more open right after this.